This video talks about management strategies for pain and swelling. It's going to be normal to have some pain and swelling when you're recovering from an injury, but it's also important to keep that pain and swelling controlled. If you're able to keep it controlled, you'll be better able to participate in your physio exercises, as well as just progress your overall day-to-day activity. So one of the things that can be helpful is elevation. So anytime your hand or your wrist are swelling, to get it elevated, okay? In that position as well, you can combine in some massage. So you want to start at the fingertips and then just work lightly up the arm. It doesn't have to be a deep pressure massage, just that light massage can help to reduce pain levels as well as the swelling levels, okay? While you have your hand elevated as well, you can also do some range of motion exercises. Keep them gentle, you don't want to push into pain, and that can just be moving the wrist back and forth, as well as opening and closing the hand, okay? Those techniques can be done 3 to 5 times a day, okay? So again, those are elevation, massage, and gentle range of motion, okay? Other strategies that can be helpful are using some compression. So if you are doing an activity, maybe a household chore task that you have to do, and you know that it might cause some discomfort or swelling, you can use a tensor bandage or use a wrist brace just while you perform that activity, okay? Another technique is using some cold packs. So I like to combine some elevation at the same time as this. For the cold packs, you just want to wrap them in a damp cloth. You don't want to put that cold plastic right on your skin. And you can sit with that wrist elevated, and you want to give about 10-20 minutes with that cold on. So if you're doing some reading or watching a show, that's a nice time to get it elevated and get some cold on. Okay. Another technique that can be helpful is using a contrast bath. So if you have a double sink, that can work well, or get 2 buckets full of water. You want one of the buckets to be warm, and you want to fully submerge that hand into the warm water for 30 to 60 seconds. And then you want one bucket that has cold water. You want to get some ice cubes in there. It should be quite cold, and it's going to be a bit of a jolt when you first put it in, transitioning from the warm to the cold, but you want to go spend about 30 to 60 seconds in that cold water as well. And then you're going to repeat that sequence. You're going to go back and forth between that warm-cold sequence for about 10 minutes. That can be really effective at calming down the pain levels and the swelling levels. The last thing you need to do is just monitor your activity levels. If your pain and your swelling are really spiking on you, then it might mean you're just doing too much, and you just need to scale things back and slow things down a little bit.